During your orientation, we're going to talk to you about your physical and required immunizations. I will tell you right now, call your physician's office and schedule yourself for a physical the week between Christmas and New Year's, or at least the first week of January. If you wait until you find out that you were admitted into the program and you call, they are just going to laugh at you because the doctors schedule out months in advance. It is much easier to cancel the appointment if you don't need it than it is to try to get it at the last minute. All students have to have an annual physical exam, and that includes immunizations or blood work to show immunity. Deadlines must be met, and failure to complete the physical and immunizations or to meet the deadlines will result in removal from the program. Now, when it comes to immunizations, you have to be aware that we must follow the guidelines of our clinical affiliates. It is not HAC that says you have to have X, Y, or Z. We are guests at these institutions, not employees. Also be aware that the hospitals may not accept waivers for any immunizations. So if you need to do a waiver for an immunization, we cannot guarantee that you will be able to complete the clinical portion of the program if the hospital says we will not accept a waiver. Of course, the big one everybody worries about and talks about is COVID-19. Currently, COVID-19 vaccine is not required by our hospitals, but that could change. If you have not had the COVID vaccine for the current year, you will need to complete a waiver form, and we will have that on record. You are required to have a flu shot every year. And the deadline for the flu shot is usually the end of September. So you need to have the flu shot for the current year. Now, you will not need to have the flu shot to get into the program because you will not be going into the hospital. But you must have other immunizations. Measles, mumps, rubella, or MMR. You must have the required shots that are listed on the health form, which we will give you, or you have to show immunity via blood test. Having had the disease is not sufficient. The hospitals will not accept that. I will tell you, I say this to students every year. You are responsible for your health form and that it must be completed. We are telling you what it must say. If your physician does not agree, then I suggest you find another physician who will agree to it. Because your physician may not like it, but the hospitals require it. This will also be the same for varicella, which is chicken pox. Having had the disease is not sufficient. You must have had the required vaccinations, or you have to show immunity through a blood test. Diphtheria, pertussis, and tetanus. Anyone over the age of 20 going into a healthcare field should have a pertussis booster. So if you have not had a DPT, you have only had a DT, then you're going to want to get the 3 of them. It is a required shot, and it is only good for 10 years. The pertussis is good after you get your booster after the age of 20. But the diphtheria and tetanus are only good for 10 years. If it has been more than 7 years, then you will have to have a booster. Next is TB, tuberculosis. You must have an annual TB screen while you are in the program. Now, there are 2 things you can do. One is what's called a PPD, and that is a 2-step process. And that's where they put a little needle under your skin, and you have to have 2 of them. They have to be 14 to 21 days apart. Anything longer than that, and you have to start the process all over again. Now, the other way we can do this is a blood test. And you can get the blood test done instead of the PPD. However, if you are PPD positive, if you were not born in this country, you may have been immunized against tuberculosis. So a PPD is going to come up positive for you. You will have to have the blood test, and you may be required to have a chest x-ray. The last immunization we need to talk about is hepatitis B. Now, hepatitis B is not actually required yet. It may come in the future. But we strongly recommend it. The problem is, it's expensive. So if you have not had your hepatitis B vaccine, I would recommend you wait until you become employed by the hospital, and then you can get it for free. If you have not had your hepatitis B, you will need to fill out a non-immunity form from the Director of Clinical Education. Now, there are other immunizations that will appear on the health form. These are not required, but recommended, and it helps you by keeping everything in one place for you. So things like HPV, hepatitis A, other types of vaccines that you may have received, pneumococcal pneumonia, shingles, whatever. As I said, those are not required, they are recommended, and you will have them on your form. Next, we're going to talk about the drug and alcohol screening.